Good evening, everyone. Thank you for joining us this evening for what will be a very informative webinar on the Open Enrollment Period 2016 and also the resources available to help patients and families as they are learning more about open enrollment and how to shop the marketplaces. My name is Linda House, and I'm the president of the Cancer Support Community, welcoming you on behalf of our guests this evening, VJ Slate and also Fran Costello from the Patient Advocate Foundation, and then importantly on behalf of the partners who worked diligently on a project around the cancer insurance checklist. And those partners are listed on your first slide, so I won't read all of the information there, but know for sure we could not have done it without these partners, and each of them has materials and resources that would be helpful to you and your loved ones alongside your cancer journey. So just a quick overview of the presentation this evening. So we really felt like it would be important to do a basic bit of information on the Affordable Care Act. We would like to talk to you about the Open Enrollment Period, which opened just a couple of days ago and will be open for the next couple of months, but it's incredibly important for individuals to understand what those time frames are so that you can make your appropriate purchases within that narrow window of time. Understand a little bit about the health insurance marketplace. So what are these marketplaces? What do they offer you? How do you learn about them and best make your decisions? What are the enrollment basics? What are the things that are really important for you to know and to think about as you're moving forward with this open enrollment period on the health insurance marketplace? How do you choose a plan when there are so many options available to you and you may or may not know what you're going to be facing in the next year? How do you step back and choose a plan that's right for you and for your family? What financial assistance is available to you? What's new for 2016? So maybe you did shop the marketplace for the 2015 open enrollment period, but what's new for the 2016 open enrollment period that you should be thinking about? Again, what resources are available to you, information and resources. And then we're going to spend some time talking about the Cancer Insurance Checklist, which is a tool that is really helpful to anyone who has a chronic illness, not just cancer, as you think about what your needs might be and how you make choices on the marketplace. And then we're going to hear from VJ Slate, who is someone who has had the opportunity to work with the marketplaces now over the last couple of years. So she's going to give us a little bit of the ins and outs of her experience as someone who has been shopping on the marketplace and who has been having to make decisions alongside her health care based on what's been available to her through the marketplace and her particular enrollment. And as always, we want to be open to questions and answers. So we have on the right side of your screen a place for you to enter questions that you might have. And we will commit to you that we will get to as many of them as we can while we're on the webinar this evening. And for those that we don't get to, we will respond to you directly. So please take advantage of that. And then at the end, I'll give you a little preview. We do have a list of all resources available to you with contact information, so you can reach directly out to any of the partner organizations who have participated in the Cancer Insurance Checklist project. So without further ado, you can see on your slides that I would like to introduce you to my friend, Fran Costello, who is the President of Operations at a wonderful organization called the Patient Advocate Foundation. So the Patient Advocate Foundation works with a number of individuals on issues related to affordability and financing for chronic illness. Big part of that is in cancer care, and I'll let Fran tell you a little bit more about the organization. But Fran's been with the organization for over 15 years, where she's been working directly with patients and families and other stakeholders in the community to form and shape healthcare reimbursement and patient access for people who have chronic illness. So with that, Fran, I will hand the slides over to you for you to take us through some information.
Thank you, Linda. I appreciate it. Well, welcome, everyone. I appreciate the opportunity to be part of this evening and share a little bit with you about the marketplaces, the Affordable Care Act, and give you just a little bit of advice that comes to you from my colleagues here at Patient Advocate Foundation, our professional case management staff who actually work with thousands of patients every year as they make decisions around their health care coverage as well as navigate that coverage once their plan year starts. So just a little bit about our organization. If you're not familiar with Patient Advocate Foundation, we were formed in 1996 with the mission of assisting patients who are chronically or critically ill navigate the reimbursement landscape, very practically dealing with coverage issues, lack of coverage, as well as debt crisis and employment-related issues that might also impact their ability to stay on therapy. We provide a lot of financial assistance as well in the form of copayment relief, as well as some small grants programs. To date, we've served about 800,000 people, mainly through direct contact with our case management team. In 2014 alone, we served about 89,000 people, made about 1 million contacts on behalf of those folks to relevant stakeholders in their lives and in their patient care to navigate whatever barrier they were facing. About 340 different diagnoses were represented in our population in 2014, and as you can see, the majority of our patients, one of their issues is something related to medical debt or some financial need that's impacting their ability to seek and stay on therapy. We did provide about $50 million in cash assistance to patients who have particular conditions and are unable to afford their copayments or have travel assistance needs. So I was asked here tonight by the cancer support community, because Patient Advocate Foundation was one of the organizations that was a member of the coalition that designed and launched the cancer insurance checklist. I guess it's been 3 years ago now. And we were invited to come and talk with you tonight about the open enrollment period. It is a critical period for people who do not have insurance and need to get insured, and those that have insurance, and maybe it's time, it is always time, for them to review the coverage that they have against the medical needs that they anticipate having or currently have, to make sure the plan they have is still in alignment with the medical needs that they have. So I'm going to cover a few things with you tonight, including just basically what is the Affordable Care Act in a very broad brush, what and when is the open enrollment period, what is the health insurance marketplace, what requirements for health insurance are, some enrollment basics, choosing a plan, want to discuss the financial assistance that is available for a lot of folks, and it's really critical for a lot of folks to be able to actually afford the plans that they need to buy. Some things that are new for 2016, some tips from our professional case managers as you navigate the system, and then just as Linda mentioned, some open enrollment information and resources that we've pulled together. So what is the Affordable Care Act? I'm sorry, my slides are not presenting, Linda. I'm not sure what's going on with the...
Yeah, I think they're showing, Fran. I see them.
Are they?
So you've got what is the Affordable Care Act up? Mm-hmm.
Yeah, I can only see part of the text on the slide, though. So basically, the Affordable Care Act, or the Patient Protection and Affordable Care Act, as it actually is named, was a historic piece of health care legislation signed into law on March 23rd, 2010. The law established the health insurance marketplace and added some new rights and protections for people, including, and I don't know if you can see this on the screen, but I'll review them. Consumers cannot be denied coverage due to pre-existing conditions. I think that was really a hallmark of this piece of legislation, at least from our organization's point of view. Consumers can't be charged higher premiums due to health status or gender. The coverage, there is now coverage for routine care costs for approved clinical trials. There's coverage for preventative services at no out-of-pocket cost, so that obviously is of great importance. There's no more lifetime or annual limits on coverage for essential services, and there's a right to appeal the health plan decision, internal and external review processes both being included. I think it's important to point out no more lifetime and annual limits. That was actually a barrier that a lot of people with cancer and chronic illness faced. They would call us and they had maxed out their annual limits. So this change in the law actually really especially benefits people that have or may require extensive and expensive courses of therapy, where before the Affordable Care Act, a lot of those patients would have hit the ceiling or the maximum for their lifetime for that coverage of that particular therapy. There they are. So when is open enrollment? This has kind of been a shifting window. Each year it has changed slightly. So for this year, for the 2016 plan year, open enrollment actually began on November 1st, 2015. The healthcare.gov website reopened for business. And that open enrollment period will continue through January 31st of 2016. I think it's really important to point out, though, you have to make a plan selection by the middle of December to have coverage effective on January 1st. So if you do wait until January, your coverage will not begin on January 1st. It will not go retroactive. It actually would not begin until February. If you don't enroll in a 2016 plan by January 31st, you cannot enroll in a health insurance plan for the entire year of 2016 unless you qualify for a special enrollment period, which we'll cover in a few minutes. So what is open enrollment? You've probably heard that term, or you may be very familiar with it depending on what you do for a living. But open enrollment is a defined period of time that occurs each year when new enrollment and changes to current plan selections are processed. That cements the health plan choice for the full next year. Periods can range from about 2 weeks if you're an employer-based plan to a few months, which is what you are seeing with the marketplace enrollments, and Medicare enrollment period is a little bit longer as well. Changes go into effect at the beginning of the next plan year. It's really important to remember that the decisions made during open enrollment do impact and affect your coverage and what coverage you will have for the next 12 months. If you avoid a decision or don't make one, that can really have a lasting impact. You're actually going to see when we cover in a few minutes that a lot of the marketplace plans have actually put in place automatic enrollment features. So if you do not re-enroll or re-elect or review and enroll into a new product, you will be, in a lot of cases, enrolled in the plan that you have this year. So be very thoughtful and intentional in the decisions that you're making during enrollment. Think about and take the time to research the plans, compare the different coverage that's offered, project and analyze care for next year so the best you can. We don't ever know what we're going to need in the future, but we do know at least what we need today. Budget and analyze the costs. Gather together your paperwork. Make sure that you have everything available to you when you're ready to apply for coverage and for the financial assistance that does exist. And then make sure that you know the deadlines, that you get everything submitted prior to that. So what is the marketplace? This was really a novel concept when it was launched, but it is in effect an online hub that's available in every state that allows only qualified health plans to be bought and sold. All the plans in the marketplace are individual, consumer-based plans. So it allows you, as a consumer, to research and compare the various plans that are available in your state. So consider it kind of a one-stop shopping for individual health plans. As well, the marketplaces do have information and enrollment around for Medicaid and CHIPS programs. The plans are grouped into a category. They're called metal categories or metals. So when you think about the different kinds of coverage you want to buy, there's bronze, silver, gold, and in most states, but not all, platinum options. The real difference between the different options is the out-of-pocket costs that you're going to incur. So bronze effectively will cover 60% of the healthcare costs. Silver covers at 70%, gold at 80%, and platinum at 90%. So who's eligible for marketplace enrollment? There's a lot out in the environment around eligibility. So just want to kind of summarize for you who is eligible. Obviously, individuals and families who are currently uninsured. Those that currently have non-comprehensive or limited coverage. So if you have a catastrophic plan, for example, which are not recommended for people that have chronic or critical disease or who are in ongoing treatment or surveillance, you would be potentially eligible to enroll. Those people that are looking to switch from their current coverage to a marketplace product, or if your current plan was not renewed either an individual plan or a group plan, or you just want to simply compare and research coverage options. If you have employer-based insurance and want to switch plans, it's important to remember that you may not qualify for lower costs based on income unless your job-based insurance is considered unaffordable, and you may lose your employer contribution to your premium. In fact, you probably will. There is a special enrollment period for people who have a qualifying life event, and it's important to remember that if you have Medicare, you are not eligible to buy a marketplace product. So how does the enrollment process work? And I've oversimplified it a little bit here for the purposes of the presentation, but it does have 4 distinct steps. So the first step that you will take is to log on to the healthcare.gov website and create an account. You will provide some basic information. I actually did this for myself a few years ago. It is not real labor intensive to create an account. You're going to choose a username and a password, answer some security questions, and then your account will be established. Once your account is established, you actually can apply, and you will apply using that portal. Starting on November 1st, it reopened for applications. You'll enter information about you and your family. You will need to have, of course, your income, your household size, etc. And you also use that same tool to actually compare the plans so that you can choose the plan that you feel is best meets your need. So there are side-by-side comparisons based on information that you input. And then that is where you will apply for any subsidies, tax subsidies that you may be eligible for. And then you actually enroll right there on healthcare.gov once you've chosen the plan that meets your need. And if you do it now, of course, the coverage would start on January 1st of 2016. So again, looking at that apply for coverage, that enrollment process, the portals will allow you to determine eligibility for the exchange products as well as subsidies that may exist that you may be eligible for. Once you do the income verification piece within healthcare.gov, it will route you in one of 3 directions, either Medicaid or CHIP, an exchange product with a subsidy, or an exchange product without a subsidy. At that point, you'll move on to select that benefit coverage, as we talked about, one of the metals, and then the corresponding, every state has different plans that are participating in offering products in the marketplace. Then you will actually complete your enrollment. There is an in-person assistance. If you need that, you also can call healthcare.gov. They have a call center, so if you're not comfortable doing it all online, there is actual in-person and live assistance if that's something that you would like. So just some enrollment basics. Time periods do vary, and they all are defined and made publicly available. For the marketplaces, which we're talking about this evening, the enrollment does occur, open enrollment occurs in late fall of each year. As I mentioned, that has shifted a little bit each year, so it's important to pay attention to the time frame. Employer-based plans usually occur at the end of the year, but not always. Those are generally shorter open enrollment periods and would be publicized to you by the Human Resource Department within the company. Medicare open enrollment is typically from October 15th to around mid-December of each year. So it's really important to know those open enrollment periods. Also, remember that your enrollment date is not necessarily and usually never the effective date of your plan policy. So you may enroll now and your plans will not be effective until January 1st. You're going to be committing at that point to monthly premiums for the entire plan year. You have multiple eligibility options and multiple eligibility options and arrangements to enroll under. So, for example, if you are employed and you have an employer-based option available to you, and you have the marketplace that you can explore, you should explore both. It is important to note that each family member can be on an individual plan through the marketplace, or you can have a single family plan for all members. So it might make more sense for part of your family to be insured through your employer, and the rest of your family to be insured through a marketplace product. We are seeing some shifts in employer behavior where they are changing enrollment eligibility criteria for dependents and spouse, as well as the amount of premium assistance that they're offering for dependents. So I touched a few minutes ago on the fact that there are some special circumstances where you can enroll outside of this open enrollment window. And I do want to bring those to your attention in case you, a family member, or somebody you're working with experience one of these life events later in the year, because we would want them to know that they do have an opportunity to enroll in a marketplace product at that point. So some of the opportunities that create a special enrollment window are getting married or divorced, having or adopting a baby, if you lose your employer-based coverage at some point during the year, if you turn 26 or your child turns 26 and loses the coverage under your plan or under the parent's plan, at that point they could potentially enroll in a marketplace product. If you're on Medicaid or CHIPS program and you lose eligibility status for those plans, you can then enroll. If you happen to be incarcerated and you actually are released, at that point of your release, you're actually eligible to enroll. And then new employees at workplace, if the workplace plan does not kick in for a certain period of time, you would be eligible to enroll in a marketplace plan to fill that gap. Please note that voluntarily dropping coverage before the plan year ends or non-payment of a plan does not qualify as a special enrollment period. So if you drop coverage or you lose coverage because you're not paying for it, you cannot just pick it back up later. You would have to wait until open enrollment period for the next year. So there are there's always an exception to the exception, and this slide covers that. So even outside the special enrollment kind of open special enrollment window, there are some exceptional circumstances that do apply that could be considered if you miss your enrollment opportunity. For example, if you were faced with a serious medical condition that kept you from enrolling during the open enrollment period, an unexpected hospitalization or temporary cognitive disability, let's say your patient or you were in a coma for a period of time that precluded you from enrolling, that would be considered a qualifying event for a special enrollment window. If you receive misinformation or misrepresentation or misconduct by a non-marketplace enrollment assister that resulted in not getting enrolled into a plan when you thought you had, you got enrolled into the wrong plan because of bad information or the wrong assistance, or you didn't get the premium tax credit or cost-sharing reduction that you were eligible for and therefore were unable to get enrolled or thought you couldn't afford it, all of those can be considered to open a special enrollment window for you later in the year. Or if there's an enrollment error, a technical error between the marketplace and the insurance plan, they don't receive your enrollment. There's a complete list of exceptions if you're interested in those available at healthcare.gov at the link posted here. So what do you need to enroll? So during your enrollment, after you've gone through and evaluated the different plans and you're going to enroll, it's important that you have some information available to you, whether you do it online or you do it over the phone. You're going to need information about your household members, both those who will be covered and those who will not be covered. You need the age, date of birth, mailing address, contact information for everyone, Social Security numbers and individual identification materials, household income, W-2 forms. You really do need a good estimate of your 2016 income for your house. I know that that's difficult for some people to predict, but it is important that you have at least some sort of estimate so that they can calculate your eligibility for financial assistance. And then policy numbers for current health insurance plans. If you do have current health insurance, they're going to want to know about that. And Linda, are we stopping here, I guess, for some questions and answers?
I think that we are clear to move forward, Fran. I've been answering questions along the way.
Okay, thanks.
And sending people to your wonderful organization.
Thanks. All right, so let's talk a little bit about choosing a plan. So you've probably or maybe heard the term in the marketplace, qualified plans. So basically all the plans that are offered in the marketplace have to meet a certain criteria to be considered qualified or be eligible to be sold in the marketplace. So some of the elements that are required to be considered a qualified plan is that the plan cannot deny coverage due to pre-existing condition. Consumers cannot be charged higher premiums due to health status or gender. They can increase the premium for smoking use and age. It must include coverage of routine care costs for approved clinical trials. It cannot have a lifetime or annual limits on coverage for essential services. The cost of preventative services have to be zero. They have to be paid at 100%. So that the consumer's not paying out of pocket. There is an exception to that we won't get too in depth with tonight, but just want to point out that there are some policies, particularly in the employer environment, where plans are considered grandfathered. If a plan is grandfathered, they do not have to follow all of the ACA rules and provisions that we're outlining here. So it's really important, especially if you're an employer-based plan, to ask if the plan has been grandfathered, because if so, then you will not see some of these improvements that came as a result of ACA. There's 10 categories of essential health benefits coverage. They all have to be represented in the plan. There has to be a defined list of services that are not covered or excluded within the plan language and made visible to you. And your insurance plan contains the provisions of your contract with the insurance company to provide medical services. So just mentioned the essential health benefits. These are really those benefits that the government and the legislation determined to be most vital to a policy, and they include coverage for prescription drugs, rehabilitative and habilitative services and devices, emergency services, maternity and newborn care, preventative and wellness services, including chronic disease management, services for children, dental and vision, mental health and substance abuse, and disorder services, hospital visits, lab services, ambulatory and patient services. These are the 10 essential health benefits that all plans offered in the marketplace must have included in them, or they're not considered a qualified health plan. So when you're choosing a plan, we advise you to be very diligent in reading the plan summary. Compare cost-sharing elements, so make sure that you understand the costs associated with the copays, coinsurance, deductibles, out-of-pocket maximums. It becomes kind of alphabet soup, and it's really difficult sometimes to figure out how much am I really going to have to pay over the course of a year. That's where a tool like the Cancer Insurance Checklist can become very helpful, as well as there's a calculator on healthcare.gov. I believe that Kaiser has one also. And then our staff, of course, helps patients all the time determine what their cost share is going to be by looking at the information that's provided by the plan. Review the non-covered benefits or exclusions. A lot of people spend a lot of time looking at what is covered, and they don't pay a lot of attention to what's not covered. And in cancer care in particular, that's really important to pay attention to what's not covered. Perform sample calculations for various scenarios. So, run a calculation on if you went to a hospital and spent $2,000, what would be your exposure at that point. Know the difference in the plan types between an HMO, a PPO, point of service, and understand what your typical medical needs are. As far as prescription coverage, remember those are, that's a whole different set of coverage. You want to make sure that you know what products you're on and confirm that they are on the plan's formulary, and a formulary is just a list of drugs that are covered. Understand the prescription tiers. So most, as you know, if you've ever picked up a prescription, you know that they cost different amounts, and Some of them can be very expensive. There's usually, traditionally has been Tier 1, 2, and 3. We're now seeing Tiers 4, 5, and 6. And so the drugs and the cost of the drugs are getting more striated. There are specialty drug tiers. That's the ones I was just referencing, the highest drug category. It's really important to know if you have any products that are going to land in that tier. Most of the time you will if you are dealing with a diagnosis of cancer and receiving any sort of oral therapies. And then review your network of pharmacies or mail order pharmacy options. Keep in mind that your annual total cost of care goes far beyond your monthly premium. We see a lot of people making decisions just on the premium. So we've done a couple of example comparisons for you just so you can see how to kind of where the differences lie. So we've compared a bronze and a silver plan. These are not real. These are mock scenarios, but you can do this same kind of comparison with real data. So you can see the bronze plan has a little bit lower monthly premium, and again, we see a lot of folks gravitating towards a lower monthly premium because it fits better into their budget. The deductible is the same, but if you see the out-of-pocket maximum is not the same. So once that $1,000 deductible is met, the person in the silver plan is only going to have to pay another $250 in, partial payments of bills until they've reached their out-of-pocket maximum, where the person who's chosen the bronze plan is actually going to have to go to $2,250, which is another $1,250. So they're actually going to have an out-of-pocket exposure of $1,000 more than the person in the silver plan for not very much savings and premium each month. We continue and that really is being driven from the rest of this analysis. You can see where the primary care doctor visit copay is the same. It's both $25. In bronze plan, you actually pay a little less at the specialist, but you don't have any out-of-network coverage. Also not recommended for somebody who's dealing with a cancer diagnosis to not have out-of-network coverage. That means you cannot go out of your state generally. As compared to the silver plan where you pay a $35 copay, but you actually have out-of-network benefits where they're going to pay 50% of the bill. So we have another comparison of the drug plans, similar kind of comparison. You've got a bronze plan versus a silver plan. Generics are both $5. Prescription drugs that are preferred brand names, both $15 for $15 copay. Both have out-of-network coverage. But then you get to the prescription drug, the specialty drugs. Both have a 15% copay, but the bronze has no out-of-network coverage. So if the drug you're on is in a limited distribution or in a small distribution model of pharmacies, then you may not be able to get it, or you may have to pay the full price for it. Same with prescription drugs, that if you look at the out-of-pocket maximum on these two plans, the bronze doesn't have one, so you're going to continue to pay $5, $15, or 15% of your drug costs for the entire year, where the silver plan actually has a cap of $5,000, and once you've reached that, you're not going to pay for prescription medicines anymore until the end of the year. So a lot of people ask us if there's financial assistance available for these plans, and it's really important for you to know, yes, there absolutely is. There's a couple of different kinds of financial assistance, and the marketplace is the only place that you can apply for the financial assistance to help pay for marketplace insurance. There's two forms of financial assistance available. There are tax credits or premium subsidies, and then there's cost-sharing assistance. You may have to, I do want to point out that you may have to repay some of this if your financial situation improves during the year. If that happens, it's important to contact the marketplace and let them know about that so that they can adjust your tax credit or your cost-sharing assistance in the middle of the year so that you won't have any sort of amount due at the end when you file your taxes. If your family is enrolling into a marketplace plan, everyone does not have to enroll into the same plan. Remember, it's individually based, so it's not like employer-sponsored health insurance at all. You actually can have different plans for different parts of your family. So let's talk a little bit about the monthly premium insurance tax credit. So this is to help offset your insurance premium costs. It's a tax credit that lowers the monthly cost of the insurance premium itself. It's based on your household income has to be between 100% and 400% of the federal poverty level for the 2015 year. It appears that that's going to be the same range for 2016 benefit year also. You have to obtain a qualified health insurance. You have to buy it and qualified health insurance through the marketplace. It has to be a silver plan or higher, so you cannot qualify for this tax credit if you buy a bronze plan. You have to be ineligible for government-sponsored coverage, affordable employer-sponsored coverage, and you can choose if you want that benefit given immediately to you, so you want your actual premium reduced every month, or would you like it as a credit on your taxes at the end of the year. The second form of financial assistance is called cost sharing, and cost sharing actually reduces your out-of-pocket maximum, so it reduces your deductibles as well as those out-of-pocket limits for the entire plan year for qualified enrollees. To be eligible for this type of financial support, it's based on having a household income between 100 and 250% of the federal poverty level. You have to be enrolled and eligible for the premium insurance tax credit. And again, you have to have purchased the plan through the marketplace at the silver level or higher. Just want to touch a little bit while we can on employer-based plans. Some employers offer, as you know, numerous choices to their employees. Some don't. They may only offer one plan. All employers pay for a portion of the monthly premiums on behalf of the employee, but not always for the family or the dependents. Many have workplace requirements for eligibility, like you have to work a certain number of hours to be eligible for insurance per week or per year. And other benefits that go along with employer-sponsored health plan, including HSA accounts, flexible spending accounts, other type of supplemental plans, vision and dental plans, etc. If you decline the employer's insurance because you would like to enroll in a marketplace plan, you certainly can do that as long as the employer insurance is deemed to be unaffordable, but you're generally not going to be eligible for financial assistance through the marketplace if you do have an employer-based plan that's considered affordable available to you. So we are seeing some direct insurance options with the enrollment companies. There's some insurance companies out there that are actually matching some of the marketplace open enrollment period as well, and some of the products that are being offered. You can compare and research, the insurer's product offerings directly, and compare them to those that are available in the marketplace plans. So after enrollment, once you've actually chosen a plan and you've enrolled, you should receive a confirmation of effective plan dates following the enrollment. If you do not receive a confirmation, you need to follow up immediately. That means they did not receive your enrollment, and it's really important because of the timing and you need your plan to be effective on January 1st. It's very important not to assume that they received it. You should be able to gain electronic access to the insurer's website. So if it's Blue Cross or it's Anthem or it's Aetna, you should be given access to their website with more details of the plan, your provider network. You can search for your doctors, your formulary, your policy numbers, etc. You should get a welcome packet and a plan summary in the mail. You'll get printed insurance cards in the mail on or around or prior to January 1st. You'll get the premium invoice mailed to you and the payment details. And if you're receiving financial assistance, you will get a statement regarding that for tax purposes. So what happens if you miss enrollment? you actually may be uninsured for the year, and you will be responsible for the penalty. There is actual tax penalties for remaining uninsured unless you qualify for a special enrollment period or begin a new job offering or one of those other life events we covered earlier. You will continue to be uninsured for the year. So what's new for 2016? As mentioned, the open enrollment dates keep shifting and shrinking actually each year. The tax penalty has increased again for 2016. So if you remain uninsured and you opt not to purchase insurance, you will be subject to a tax penalty of 2.5% of the household income, or up to $2,085 per household, depending on the size of the household. There are some better defined tax processes this year around the penalty payments, proof of insurance, premium subsidy, cost share amounts. That was a little bit not as well defined in the prior years, and we're seeing improvement in the reconciliation of those things this year. Healthcare.gov has launched some improved customer service and technology experiences. Their website has been greatly improved. There's a new out-of-pocket cost feature based on users' personal situation that's available on their website. They've tried to simplify re-enrollment and the ability to compare available plans. As I mentioned, if you don't update your application or change your plans by December 15th, it's likely that you'll be auto re-enrolled, but your tax credit may not be accurate. So if your income has changed in any way up or down, it's really important that you re-verify the amount of that tax credit. States continue to tweak their Medicaid expansion plans. As we know, not all states expanded their Medicaid program, so we do still have a group of patients or people that are kind of in a gap where they're not eligible necessarily for the marketplace plans and subsidies. They're not eligible for Medicaid. So we're looking forward to continuing to see work there. In some situation, I already covered this, I'm sorry, the marketplace plans are auto-renewing, so make sure you proactively review and renew your insurance selection. And there have been improvements to SHOP, which is for small businesses. The SHOP marketplace is for small businesses to actually offer health insurance to their employees. So I surveyed and talked to our staff here at Patient Advocate Foundation, and I just said, you know, give me the down low, guys. What are you seeing as you're working with consumers who are calling you trying to navigate to insurance, choose a plan, get financial assistance, and ultimately enroll and then use their insurance? Unfortunately for us, we're still seeing people who cannot afford the premiums. They're still unaffordable for a lot of folks. Some of the individuals are not eligible for premium subsidies, and so when you combine the premiums with the yearly deductibles, the coverage is just out of reach, and so folks are staying uninsured. We have noted, as I mentioned earlier, a shift in some of employer behavior. They've started to increase their deductibles or shifting to offering only high deductible health plans. They're restricting their networks a little bit, and then they're also excluding support or reducing support for dependents. Cost shifting within employer-sponsored plans have prompted actually some of our patients to reduce their hours. They're actually going part-time in order to lose the group coverage so that then they can buy an insurance product of their own choosing on the marketplace. Patients are making decisions on plans simply based on their premium. I cannot stress how important it is to not do that. We really need to look at the entire out-of-pocket cost for the patient or the person for the entire year to really be able to make a solid decision around the best plan. So it's not just the cost, it's the cost and the coverage, but it's got to be the total cost that's being evaluated. So some of our patients fall under 100% of FPL. They cannot document their current income, and therefore they are not qualifying for the premium tax subsidy. Their state did not expand Medicaid, and therefore they're unable to afford or obtain insurance. due to the high premium costs that they would be subject to. So that's a really tough group of folks to work with. So if you're working with any of them, just be aware that that's happening to them. We're noticing that there is at times a disconnect between insurance companies and the marketplace. We're having to facilitate a lot of calls between the patients and the plans in the marketplace to make sure that the enrollment and the coverage the enrollment's actually happening, and then coverage issues as they use their insurance policy are being worked out. It takes a lot of time. It frustrates a lot of our patients. So again, if you're using the online tools, or even if you're doing your enrollment over the phone, make sure that you get that confirmation, and if you don't, call them back. So a few tips from our case managers. If this is the first time that you've had coverage, it's really important to familiarize yourself with insurance terms. I think health insurance literacy is a real gap in our country. A lot of folks do not understand the difference. They don't know the difference between a copay versus coinsurance versus deductible, et cetera, and how that accumulates to represent your total out-of-pocket for you as the insured. We've included in this presentation at the end some of those common terms and the definition of each. We have lots of materials available on our website around this particular topic that are there for your review and download, and of course always happy to help educate people on this topic. Open enrollment only occurs annually, so again, we stress the need to review your coverage every single year. Don't just assume that it's still good. Take a look at it. Make sure that it's working for you in your current situation with your current treatments, the medications that you're on, the physicians that are seeing you, the network hospitals that you like to seek care in. Just make sure it's all included and covered. So around plan selection, just touched on this. Make sure your current physicians and medical facilities are in network with any insurance product that you select. Does the insurance product allow any out-of-network options? Make sure your current medications are on formulary, and consider the tiers that these medications are on. We're seeing a lot of shifting of medications among the tiers. So you could find that, medication that was Tier 2 this year could be Tier 3 next year, or Tier 3 could become a Tier 4, depending on the plan design. Don't pick a plan with limited coverage or lower premiums simply because you currently have no or limited health issues. So you're well or you're in a surveillance mode. You never know what's around the corner. So it's very important to, from an insurance perspective, kind of plan for the worst. A lower premium probably means, not probably, always means a higher out-of-pocket maximum if you're going to then use those health care services and coverage. So it's really best to weigh your options with that in mind. You may end up paying more in the long run if you pick a policy with the lowest monthly premium, because you're actually going to end up paying more of each bill when you use that health care. As I mentioned, catastrophic health plans are not recommended for patients with ongoing treatment or surveillance needs. They are designed to cover only major medical episodes and can leave you with a huge bill. Patients diagnosed with or being treated for cancer really should consider at least a gold plan. Remember, silver is the minimum base plan to be eligible for financial assistance. But outside of that, when you really look at the long-term expense of a cancer treatment or a year of cancer treatment, we really recommend at least a gold. If there's a platinum plan available in your area, in your state, it's likely to be the most affordable over the course of the year. It's not available everywhere, but if it is, it's worth looking at. As far as financial assistance, make sure you evaluate whether you may be eligible for financial assistance. A lot of people think that they're not eligible, only to find out that they are. So it's worth the effort to go through that eligibility process. Make sure that you have a solid idea of your current household income when applying for the tax subsidy. When you file your taxes at the end of the year, there could be a discrepancy. If there is a discrepancy between what you stated when you got the subsidy versus what your actual household income is when you file your taxes, you may owe more money for your premiums due to a decrease in your subsidy. So if you have changes to your income, if you go back to work or you win the lottery or anything that's of significance, it's important to communicate that back to the marketplace when it happens. Then they can rerun and recalculate the tax subsidy or the cost-sharing subsidy that you may have and adjust it accordingly so that you don't owe at the end of the year. And just some final reminders, do not wait. Do not wait till the last minute, Christmas Eve or New Year's Eve thinking that you'll just run and, jump online really quickly along with the thousands of other people who have waited and finalize your enrollment. It's really important to do it as early as possible so that you have as much time as possible to think about the choices that you're making. Pay your premiums on time. Your policy will cancel if you do not pay that premium. And this does not qualify you for a special or a re-enrollment period. So even if you don't receive a bill, our case managers say to call them and find out where to send your premium to because they're really unforgiving on this point. Be thoughtful and intentional in the decisions made during open enrollment. And if you need it, help is available. I know there's a lot of dependency and steering towards online tools, and a lot of times that's not the best way to talk through the options that are available to you, make that decision, and actually enroll. I'm a firm believer health insurance is a really important thing for all of us to have, and it's something that we don't do enough due diligence on when we're purchasing it. So it's very important to take advantage of organizations like mine and the cancer support community. There are definitely assisters and enrollers in your communities that can help you. There is the 800 number that's offered by healthcare.gov. So if you're unsure or you just have a question, find some help because there's a lot of it out there. This is that plan vocabulary. I won't go through all of these. They're going to be available in the form of this webinar, and then I believe we're going to make these slides this presentation available as well. But these are some really important vocabulary for everyone who's purchasing and using insurance to understand. And then we have put together a couple of pages of resources for you or those that you're working with that all prove to be very helpful in answering questions as well as helping you to assimilate the material that you'll need to actually enroll in a health plan, and then some sample information about different aspects of care, including coverage cost calculators, some sample of a summary benefits and coverage document, and how the materials should look when you receive them. There's the FAQ. The FAQ from the Kaiser Family Foundation is very informative. And then, as I mentioned, the subsidy calculator. And of course, the source of a lot of this information is healthcare.gov. There's lots of information available on their website. Linda, I'll turn it back to you.
Yeah. Thank you, Fran. That was really a lot of information and very informative. And so we appreciate you being here with us and sharing that. I know that you'll be sticking with us until the very end in case we do have some questions that come up. So let's just dive into the cancer insurance checklist. And as you've heard from Fran, there is a lot to think about as you're making these decisions. And many of you know that already because you've been in the process of doing that for yourself. So a group of organizations came together when the marketplaces first were launching in 2013 to try to create a resource for patients so that you could just take all of this information and plug it into a framework in a way that would make sense for you. And the cancer insurance checklist was created. The website, just so that you have it, and it was just on one of Fran's slides, is www.cancerinsuranchecklist.org. If you go to that website, not only will you be able to download the tool itself, but there are a number of resources, many that Fran mentioned, the Kaiser site, the cost calculator, Fran's website, our website, all of that information is available to you. So as you're starting early to navigate through this process and you have questions, those are resources that are available to you 24/7 as you're coming up with questions that you want to have answered. So let me tell you what the Cancer Insurance Checklist is. It is a tool to help you document your current situation, what your future needs might be, and it allows you to compare those two scenarios so that you can make the best decision for you as you're shopping the marketplaces. So what does it look like? I'm going to show you. The Cancer Insurance Checklist essentially has 3 worksheets. So the first worksheet is called My Care, and it allows you to really sort of put all of your information in one place. So as you're looking at it, you can see my primary care doctor is, my specialists are, my hospital is, other places where I might get care. So if you're going to a freestanding laboratory or a freestanding x-ray, or as Fran mentioned, a specific pharmacy, you'll want to note all of those things. Where are you getting care? Where are you receiving supplies, including your drugs, et cetera? This is the worksheet that you're going to want to use when you're comparing in and out of network. That's why it's important to have all those in one place. One of the things I will mention to you that gets a little tricky is if you go to a particular hospital system who happens to contract with physicians, you need to make sure that not only that hospital system is covered as a part of your network, but also those physicians with whom they may contract. So if you're anticipating a surgery, you want to know who your anesthesiologist is, for example. If you're going to be having a mammogram, you want to know who's going to be reading that report from a radiology perspective. So this is a sheet that it's really important for you to take time with and make sure that you start to think about and document those scenarios that might apply to you. The next page of the Cancer Insurance Checklist talks about treatment and health services. So when you think about what your particular needs might be, think about whether or not they're covered. In-network, out-of-network, what the cost might be. Go down this checklist to make sure that you're thinking through anything that might be possible for you. We've tried to make this list as comprehensive as possible. So there may be things not listed here, but it's pretty comprehensive, and it does also include the essential health benefits. So what we tried to do was include that package that Fran mentioned of the benefits that have to be as a part of every plan, but then also think about things that may not be required as an essential health benefit, fertility, for example, to make sure that as you're shopping and reading through this and planning, you can have a line of sight into those. The final page of the Cancer Insurance Checklist allows you to compare worksheets number 1 and worksheets number 2. And it allows you to compare them as they relate to the plans. So you've heard Fran talk about the metal plans: platinum, gold, silver, bronze, catastrophic. So, and just to be clear on catastrophic, if you have a history of cancer, you do not want to have a catastrophic plan. That literally only covers catastrophic care, so a major event. So, we have that listed, but as Fran said, we'd like for you to start in the gold column and work to the left versus in any of the columns to the right. So you can see there that it's the number of people in your household. It really helps you get a good financial picture of each of the scenarios that may be of interest to you. And this checklist is downloadable on cancerinsurancepchecklist.org, or you can contact us, and we would be happy to send you as many copies as you'd like. You can share them with others that you know. So again, the website is here. This screenshot in particular gives you a little bit more background information of what you will see and find when you get to the Cancer Insurance Checklist website. For those of you who either are Spanish-speaking or have Spanish-speaking friends in your network, we have translated the entire website as well as the Cancer Insurance Checklist into Spanish. So that's also a resource that's available to you. The following slides are the organizations which participated in the development of the cancer insurance checklist, and also organizations that would have resources that are widely available to you. So we've tried to list by name, by website, by telephone number over the next couple of slides who those organizations are and how you can best reach them in case you do have some additional information specific to your particular scenario. So with that, and again, I'm going to encourage you to continue to submit your questions. And as you are submitting your questions, I want to introduce you to my friend VJ Slate, who we became friends through the work of trying to better understand patient access to care through the implementation of the Affordable Care Act. And I was really lucky to be introduced to VJ, who lives in Southern California and has extensive experience across a variety of areas for her work. She is a tobacco treatment specialist. So, Fran, when you were talking about smoking, I sort of cringed, thinking we need to put up the link to VJ's book on smoking cessation and to the radio show that she did with us to help with that problem. But VJ is also a cancer thriver, diagnosed when she was quite young, and has had the experience of a variety of different health insurance plans. So, VJ, I'm going to turn the mic over to you for you to share with everyone your experience pre-ACA, post-ACA, and then any suggestions that you would have from a real-world experience.
Well, thank you, Linda. Nice to talk with you again. Yeah, I feel like I've been a pre-existing condition my whole life because I had an accident when I was a child with my eyes. And so I've always realized how important insurance was, even when I was in my 20s. And I've basically been self-employed my whole life, and so I've always had to deal with the individual insurance market rather than a group policy. And so oftentimes people who are looking at these costs, if they've been in a group policy in the past and they're looking at the costs, it is significantly higher because your employer's not helping you share in those costs. Whereas I come from a background of always having to pay for the insurance myself. So when I was in my 20s, I had individual insurance policies, and they were very cheap. And I do remember pre-existing conditions at the time, what they did is you were not covered for the first 6 months because I knew I would need ongoing care for my eyes. And so I knew I had to wait 6 months. Well, over the years, that changed dramatically. I was lucky enough to have an individual policy when I was diagnosed with cancer when I was 32 years old. Now, this was back in 1987, and things were a whole lot different back then. The premiums were not unaffordable. I was not working, but the costs were not out. The medical part of it was really not an issue at the time, and I was just really lucky there. But I think it was because I was so young. Insurance was cheap back then, and I had the very best policy you could get. Well, because I'd had cancer and now pre-existing conditions started to be excluded, I knew I could never get another policy, and I had to stay with that individual policy basically forever. And over the years, it got more and more expensive. Not only just costs kept going up, but then I got older, and so in 2010, I was 55. My premiums were slightly over $500 a month, and my out-of-pocket was $9,000. So when you talk about don't choose a bronze plan, the out-of-pocket wasn't even close to what I was paying on the individual market back then. And so the other thing I wanted to mention is there is also a window for certain income levels. There's a Silver Plus plan that is a silver plan that is like having a gold plan. And so that is available also. Now, I am in California, and so we are through our own marketplace out here. So my experience may be different from some of the other states. But in 2010, I had a cancer reoccurrence, and so I knew immediately it was going to cost me $9,000 out of pocket for surgery. And so people who are having these considerations and they have this come up, what I did is I called the hospital that I was going to be having surgery at and asked, do they have any plans for people like me? And they actually did. And so they were able to actually cut down the amount of money that I needed to pay them for my surgery. And so you can negotiate with the different hospitals. My total surgery was about $80,000, and so my portion of it, instead of being $9,000, they charged me $1,300. So you can negotiate sometimes with these different hospitals, and they do have different resources available. Or to talk to a social worker at the different hospitals, there might be some local resources that they have available to help with costs. Now, what I've done, and that was a very expensive policy, and unfortunately, that was towards the end of the year, and after my surgery healed, they wanted to do chemotherapy. That would have fallen into the next year, and it would have been another immediate $9,000. And so back then it was very, very expensive to be sick with cancer. And so one of the things I am really thankful for with the Affordable Care Act is now I do have a choice to look at that. What I eventually did was, when the Affordable Care Act was upheld by the Supreme Court, I let my individual policy go, and you had to be without insurance for 6 months, and you could apply for the PCIP, which is the pre-existing insurance plan. This was also through the Affordable Care Act, but it lowered my out-of-pocket cost from $9,000 down to $1,500. The monthly premium was still the same, but it was the out-of-pocket, which I happen to meet almost every year because of ongoing medical issues. So when the plan, that was only until the plan was fully implemented, which it was a couple years ago. And at that time, so what I did is I called all of my doctors and just said, what plans are you taking? And they know. Now, you've got to be really careful, because I did this last year and I'm doing it this year. I actually called one of my eye doctors. One of the conditions I have strabismus, which is crossed eyes, and I will need surgery on that again. And in my area, there's only one doctor in the area that performs this surgery. For me to have to go outside the area, it's about a 2.5 to 3 hour drive to go into Los Angeles. And so I called his office last week, and I said, okay, I'm going through, I'm changing insurances again, and so I'm looking at these two different plans through ACA, and I just wanted to see if you were, what you're taking. And she goes, oh yeah, we take both of those. That's not a problem, just as long as you don't get it through Covered California. And I said, well, that is the ACA. And she goes, oh, well, I thought you meant Obamacare. And so even at the doctor's office, they aren't even sure what's going on. Now, the first year with the Affordable Care Act, I went to him, and he said that, yes, we do take this insurance. The insurance company, I called the insurance company to make sure there would be no issues. Yes, he's covered and everything. And then when I got the bill, they said, oh, he's out of network, and no, you have to pay the full amount. And I did appeal that. And I'm very good at writing letters on everything. And they actually did reverse their decision, and they ended up covering that doctor's visit, but said they will not cover any further visits with him. What's really strange is he is still on their list of it as an approved doctor. And so what I've really learned is, you really have to document when you talk to people, if you're going to see somebody new, on whether they're covered or not. In case that comes up, because oftentimes they just don't know, and it can change later on, which is still better than the way it was before with the individual market. The last time I had cancer, I did have a bilateral mastectomy, and the insurance company denied the last stages of my reconstruction, which I thought was against the law. And it turned out that after all my digging, I find out that the individual insurance policies were not covered by the Women's Health Care Act that made insurance companies have to cover mastectomies. And so, it was not covered, and they had every right to refuse me. So I've learned to write a lot of letters, and sometimes you can get them reversed. I thought it was a very good point. You need to find out what companies your doctor is going to contract with, but also the hospitals. My oncologist was not going to take any PPOs out here. He was going to take an HMO. And I called the hospital, and it was just the opposite. And so he's right next door to this hospital, and it's like, and I actually called the hospital 3 separate times because my oncologist office, oh, no, you're mistaken. Oh, no, they're going to take this. And they didn't. And so there's a lot of confusion over who takes what insurance. And there's 3 hospitals where I live at, and I've called all 3 hospitals because in an emergency, you don't know which hospital they're going to take you to. You're just going to end up wherever they take you to. There are some really great things. Before the Affordable Care Act came into play and I was on individual insurance, I had, because of ongoing medical issues, I was having to have routine blood work twice a year, and that was running $700 to $800, and that was considered part of my out-of-pocket. And now that is considered routine lab work, and I've got a $15 copay. So my total costs have gone down substantially. This last year, my out-of-pocket, going towards out-of-pocket, not considering the copays, the doctor copays, but for lab work and medical work, it was only $500 I needed to have an MRI, and that one I did have to pay out-of-pocket. So when you look at the overall cost, it has gone down substantially. What I have found working with my exchange is that it is very laborious, and you don't always get the right answers. This year, each year they will send you a form that you file with your tax returns, and I did not get one this year. And so I was waiting for it, and it's getting close to April 15th, and I actually called. I had called in January, and they said, yeah, we've sent them out. Just call us back if you don't get it in 6 weeks. I called back in 6 weeks. They said, oh, no, as long as you get it before April 15th. So the week before, I didn't get it. I called, and she says, well, you didn't have insurance last year. And I'm going, yes, I did. No, you didn't. You don't get a form. And it was like, okay. So I filed my taxes, and then the IRS got a hold of me and said, you need this form. So I called back to Covered California again, and they said, no, you didn't have insurance last year. And I'm going, I did, trust me. And luckily I had to call back a second time, and I got someone who was very helpful, and for some reason they created 2 accounts for me, and they had the wrong mailing address. I'm still waiting for the IRS to figure out what I owe. Because I'm self-employed, it's very difficult to always estimate my income, and last year I did underestimate my income, and I will have to pay some of the premium back, but I have absolutely no idea. I'm still waiting for that from the IRS, and every 6 weeks I get a letter from them saying, we're working on it. So there's a lot of questions still about and tweaking this system. The other thing is if you're new to an area, I had a girlfriend who moved to Colorado, and she was not familiar with any of the plans up there. And so what she did is she actually asked different people, what systems do you use? What is known here? And it happened to be like Rocky Mountain Medical or something like that, which we wouldn't have here in California. And so it's really to ask around. If you either don't have insurance or if you are moving to a new area, I would ask around to people who are already on the individual market. I have here in California, I have a girlfriend, and her boyfriend had never had, he's self-employed also, and had not had medical insurance. When he applied and called Covered California, the lady suggested that he go with Blue Shield. Well, after he signed up and gets enrolled and he goes to try and find a doctor, there aren't any doctors locally here that take Blue Shield. It's just not really available locally. And so it's really important to find out who is covered and not just listen to someone on the phone, but find out from your friends. A lot of people know, and know people that you have that have medical issues that know. I think it's really important also on whether you're in treatment or not. Now, I am not being treated for cancer at this time. I've hit my 5 years, and so I really have no issues with that. And so my oncologist is out of network, and I'm okay with that right now. And I do understand that if the cancer were to return, but if it were, I would probably go into, like Los Angeles, into UCLA, which does take my insurance, even though my oncologist does not take my insurance right now. I'm still waiting for my ophthalmologist because I do need eye surgery, and he's just really resistant to taking any plans under the Affordable Care Act. I think finding out, hopefully with a lot of people, your income situation is easy to figure out where you are, but I'm self-employed, and most of the people that I know that are on the Affordable Care Act are self-employed, and it's sometimes really, really difficult to figure out your income. I had one girlfriend, and when she first started to enroll, they said that she didn't make enough money and she'd have to go on Medicaid. And she did not want to do that because there's limited options out here, and really had to work with her accountant to tweak her income to see if she could squeak by and get into one of the plans. And she was able to. She actually makes a little bit more money than she thought she did. So it's really important to know what those amounts are. And with myself, it's the first year I really underestimated my income, and then this last year I had my book printed, and so I had additional costs, and I really underestimated my income for this last year. I underestimated one year and overestimated another year. If you took the 2 years together, it all evens out. And so, and I have rental property with depreciation, which is really just a paper loss, and yet that is counted also. So my income looks even worse than it should, and it's kind of difficult, and it is kind of scary to see how much I am going to owe on these subsidies when the IRS figures this out. But again, I figure that it'll still be less expensive than I'm used to paying in the past. So those are just some of my experiences with the Affordable Care Act. Overall, I think that I'm so grateful and thankful because for years I knew that if the cancer came back, I could be one step away from bankruptcy because the costs were so unaffordable. And also, with my experience with the individual health insurance was that there was nothing to say that they were even going to cover my costs because it was the wild, wild west then, and the insurance companies oftentimes did deny claims, and that can affect your insurance. So overall, I think there's a lot of things that need to be tweaked on this to make it even better for us, and I wish the politics would get out of it, but I really am thankful that we do have choices now, whereas before there were no choices at all.
Great. Thank you, BJ, for that insightful presentation. We really appreciate that. And a plug that I'll make based on your last comments when you talk about the politics of things. So, just to remind those who are listening either to this live webcast or to the follow-up webcast is to do what you're doing and get involved with organizations like the Cancer Support Community, like the Patient Advocate Foundation, the National Patient Advocate Foundation, and I know that you're active with the American Cancer Society on policy issues so that we can talk about how do we inform and raise the patient voice to those who are setting policy that may not really experience it to the level that you've just eloquently presented to us, the way that you've experienced it. So I'll put in a plug for our listeners to think about getting involved in on that level as well. So to conclude tonight's presentation, just a couple of reminders. Number one, we will be sending the slides out. This program will be available on a link, so it's a downloadable link that you'll be able to listen to again or forward to your friends. So we will be sending that out to you as well, and it'll be posted to all of our organization's social media and properties, so you'll have easy access to the information that you've heard this evening. So a couple things that I just want to recap, and Fran, I'll ask you to jump in if I've forgotten anything important, and BJ, you as well. A couple things. Number one, first and foremost, do not wait. The open enrollment closes January the 31st. You need to be well ahead of that, even if you are just getting to a point now where you're starting research. Get your research done way ahead of time before that particular end date. If you do not make that date, you may be uninsured for a full year. Number two, make sure to do your homework. Think about what your needs might be. Try to anticipate your needs. Document what your current needs are. And, again, really important to look at the specialty tiers of your drugs, the specialty tiers of your healthcare professionals, in and out of network, those key questions. Number three, think about the whole picture. We heard Fran say several times it's not just about the premiums, and so many times people think about that monthly fee, and some of the research that we've done in the cancer support community indicated that as well, that they're worried about the monthly fee versus what's going to happen when you start to get those bills, the co-pays for x-rays, the co-pays for drugs, the co-pays for your specialist. So make sure that you think about the whole picture and put all those cost pieces together. Number four, be clear on your networks. And you heard BJ just say that if she were to have a cancer recurrence, she would be going to LA. So she's fully informed of where her providers are and where they aren't, and think about how that might influence you. Number five, negotiate. And you heard BJ say that you can negotiate costs sometimes with care providers before you even have services. So always ask the question, how much is this going to cost me out of pocket? And feel free to negotiate. And then I would say please visit the cancerinsurancepchecklist.org website, where you can download multiple copies of the Cancer Insurance Checklist to help you as you start to form your thinking and document your needs, and then also have free access to our organizations who stand ready to support you now and through your cancer journey. Fran and BJ, did I miss anything?
One last thing. Don't always look at the premium that you've got on your website. Right now, I am comparing different policies, and it looks like my premium is going up over $100 a month. But they did the same thing last year, and when I got my renewal from my insurance company, it had only gone up $25. So don't always trust the figures that are on there right now. You do have a little bit of time. Don't wait until at the last minute, but always don't jump right in the beginning and go for the cheapest plan right now. Those figures may change. I know they did for me.
Great. Thank you for that reminder. Fran,
Linda,
anything that I've missed?
No, I think you covered a nice recap there. Just from our team's perspective, you covered well not to wait. Exhaust all available options. If you do have employer-sponsored plans available to you, as well as potentially marketplace options, it's not a bad thing to look at both and kind of see how they may or may not work together. It's really important to make sure that you have all the information together when you're ready to enroll, and can't stress enough to follow up if you do not receive confirmation of enrollment, and make sure those premiums are paid on time.
Great. Thank you. So on behalf of the Cancer Insurance Checklist partners, those who were listed on the slide at the beginning, and I'll bring them up here, we'd like to thank you for joining us this evening. I might also like to thank our sponsor, Novartis, for allowing us to make this resource available, as well as print resources. Again, just a reminder, you can have copies of that as well if you'll contact us. If we have not answered your question yet this evening, we will get back to you with an answer within the next 24 hours, and also the materials that we referenced earlier. So thank you for spending your evening with us. We really appreciate it. Fran, VJ, thank you so much for your partnership as always on this. You're rock stars, and I can't tell you how much I appreciate you being here. And we will wish you all well and see you at our next webinar. Thank you, everyone.
Thank you, Linda.
Thank you.